how that we came up with this program was that I discovered it actually being done by somebody else in the early days, and he's based out of Chicago, and he was one of the early pioneers in trying to do outpatient surgery. And he had a whole bunch of problems instrumenting this. At first, he was able to get a few patients home, but over an 8-year period, he learned that as long as you educate the patients and teach them what to do and their expectations and cover them for any kind of problems they may have, a lot of them were able to go home, and it had to do with education. And I'm a big proponent of making sure the patients understand what they're going through, what to expect, and how to do their physical therapy and things afterwards. Because the biggest part of any kind of replacement is not so much the surgery anymore, is to motivate a patient in doing your therapy afterwards. Now, the reason I'm able to do this, because I've been through this. I've already had hip and knee replacements. I know what to expect, what to do, and I've gone through it all myself. And I've even pushed the same issue. I was able to go home on the same program the same day with a knee replacement and a hip replacement, only because you're motivated, and partly because I'm a doctor, I knew what to expect, what to do, what medicines to use, and what to watch out for. And if we can educate the patients the same way, trust me, it's much safer to go home with a loving, caring member of your family who's more willing to bring your pain pills when you ask for it than waiting for the hour and a half with a night nurse waiting for you to give your medicine, or forgetting to take you off a bedpan. So it's much safer to go home, and you're better taken care of if we can get you there. So that's what the program's for.